So good afternoon. First off, I want to start by talking about a couple of announcements that we made yesterday around contingency planning and expanded resources for critical care workers as we deal with COVID-19 and prepare for the surge here in Massachusetts. We expanded access to the free and priority COVID-19 testing sites for first responders to now include grocery store and supermarket workers. Starting today, the men and women who provide critical access to food and other necessities can schedule an appointment to receive COVID-19 testing at the Gillette Stadium in Foxborough and at the Big E Fairgrounds in West Springfield. If someone wants to get tested, you can make an appointment in advance with by your supervisor or your manager, and you do not need to be symptomatic to be tested. I also authorized the activation of an additional 3,000 Massachusetts National Guard military personnel to support our COVID-19 response if necessary. This order raises the total authorization of up to 5,000 members statewide who may be tasked with supporting requests from state agencies for equipment, logistics, warehousing, and related duties. And many of the assignments they've got so far have also involved supporting our communities. We're taking these necessary steps to ensure we're doing everything we can to keep the residents of Massachusetts safe, and especially our frontline healthcare workers. As we continue to take measures to plan for the surge, we continue to chase more personal protective equipment, and we're working as hard as we can to make sure we have enough equipment to keep all frontline healthcare workers safe while still being able to support their patients. This remains one of the biggest challenges, but solutions like the one we're visiting here today will help us aggressively use every means necessary to make sure people have the gear they need. We found creative ways to track down more and more PPE, and will continue doing so in order to get more to the people that are battling this disease head on. But today, Lieutenant Governor Polito, Mayor Joe Curtatone, and I had the opportunity to tour this facility, which houses Battelle's critical care decontamination system, which will be able to sterilize, when it's fully operational, up to 80,000 N95 masks per day. I'm incredibly grateful for the support we've received from Mayor Curtatone in the city of Somerville, who moved heaven and earth under his emergency powers to team up with Battelle and partners and stand up this facility. This machine will keep more masks in use and will sustain our personal protective equipment supply here in Massachusetts. These folks have been working day and night to get this build done, to test the system, and to mobilize it and make it operational, and we're thankful for their efforts. On the wall here is their list of sort of existing and prospective customers, and it's a lot of healthcare facilities here in the Commonwealth whose names would be very familiar to all of you. As of yesterday, Battelle also announced that the service will be free for Massachusetts healthcare providers thanks to a federal contract. Good things happen sometimes when people work together, and this is another great example of that. The machine is well on its way to being able to decontaminate more and more masks in the next week, and will be available to any hospital and first responder system in the Commonwealth. But before I finish, I want to spend a minute talking about our efforts to ensure that COVID-19 information and services are available to people in all communities, including non-English speakers. Yesterday we announced that our COVID-19 text alerts are now available in Spanish. You can text to COVID MAESP to 888-777 to get those alerts in Spanish. As we've said before, the 211 line is available in over 150 languages, and all of the mass.gov/COVID-19 website is available in 13 languages. We've also recognized that up until now, the unemployment assistance application process has been particularly challenging for non-English speakers because of the legacy UI form is not available in multiple languages like the rest of the mass.gov website is. The Department of Unemployment Assistance created multilingual guides to the application process to help meet this need, but we've been pursuing a better solution, especially during these times of high anxiety. And that's why today we announced the launch of the Spanish language unemployment application form. The form is available at mass.gov/desempleo. It will ensure Spanish-speaking residents who are struggling with the economic disruption associated with this virus can access unemployment services and benefits. We look forward to further improving our multilingual services for all residents of the Commonwealth. And now I'd like to turn the podium over to our host, Somerville Mayor Joe Curtatone, whose team did a terrific job of working with Battelle and Partners to launch this machine. Thank you.
Thank you, Governor Baker. Good afternoon. First, I want to start off by thanking Governor Baker, Lieutenant Governor Polito, and his entire administration. You know, I think I speak on behalf of my colleagues across the Commonwealth when I say, one, none of us had a playbook in terms of pandemic response, and this is an effort that requires everybody working together. And I can attest that Governor Baker, Lieutenant Governor Polito have made themselves available numerous times a day to seek collaboration, to seek ideas, to answer our questions, and to calm us down a lot of times. So I thank them wholeheartedly. I also want to thank our partners in this endeavor, our Partners Healthcare and Battelle and Federal Realty Investment Trust, who owns this property. Although we utilized the emergency powers granted to me under our local declaration of state of emergency, they've been great partners in this endeavor, and they're not seeking any compensation. And I want to thank the governor for giving them a shout out, but I want to echo his words to the Somerville team for working around the clock. When we got the phone call from Partners a little over a week ago, my team immediately went to work. We utilized our powers, we gained control of the site, and we went through the approval process so we can get the system here, which arrived last Sunday. And as you can see, they're up and running. And we know the importance of this. Cleaning tens of thousands and sanitizing tens of thousands of these N95 respirator masks per day help give the highest level of protection to our healthcare workers, and we need to protect them because they need to care for us as we become ill. But this is also a very good example of how government, local, state, the private sector, innovation need to come together. Another good example of how we need to be nimble and move quickly and to act. And I think we've all done that here. So we're excited to have this system up and running, and it's going to help so many people in our effort to take on this crisis. Without further ado, I want to introduce from Partners Healthcare, Chris Coburn.
Thanks, Mayor. Thank you, Governor, Lieutenant Governor Polito, Mayor Curtatone, federally really led, represented today by Patrick McMahon, my colleagues, Dr. Paul Biddinger, Phil Licari, and others who've really worked night and day to get the system in place. Importantly, I'd like to recognize Greg Durand, who's the site head for Battelle. I think we have about a dozen Battelle people on site. Greg is a Massachusetts native. He's from the town of Hudson, a family well known in that part of the state. So thank you, Greg, and thanks to the Battelle leadership for backing us and making us the first site where Battelle did not previously have a facility where this capability was deployed. So in terms of Partners Healthcare, we're so pleased that we could play a role, speaking for our CEO, Dr. Ann Klibanski, bringing this innovative PPE decontamination system here where it's so needed. It speaks right to the core of why Partners has embarked in this area. We currently require, according to Dr. Biddinger, now it's gone up to about 25,000 masks a week. We expect that it will go to 45. This system and other tools will enable that growth and enable obviously the protection of frontline healthcare workers. Innovation is whether it's helping patients, protecting caregivers, improving the delivery of care, is at the heart of our system and its mission. We're the largest academic research center in America. We have over 6,000 Harvard faculty who carry out about $2 billion a year in research. Another priority for us, and Mayor Curtatone referenced this, is collaboration with the Commonwealth, with the City of Somerville, with Federal Realty. And for us, so wonderful that we could be teamed with Battelle, two storied organizations coming together to help caregivers here and all through New England, folks like Dr. Biddinger. And on a personal note, I'd just like to say, for having spent a combined almost 20 years at Partners Healthcare and Battelle. It's really a thrill to see this combination of our two organizations in this important way. So thank you so much.
Questions for us or these folks?
Will healthcare providers be swinging by to drop off masks? Will someone be picking them up? How will that all play out?
Did you hear the question?
Yeah.
You need to answer it here.
Oh, sir. Thank you, Governor. So, yes, obviously one of the challenges with the hospitals accessing this system for Boston Scientific have optimized the system to handle the flow from our hospitals and others around the state.
Can you explain what we're...
Safety of the system because the Massachusetts Nurses Association expressed concern that this is untested technology that was only recently approved by the federal government.
Yeah, I can speak to it, and others might as well. I would say, yes, it was approved by the FDA with very explicit guidance. That guidance notes the system and also the that led up to it. This is an area of expertise for Battelle that goes back decades. They run chem and biological defense preparedness for a piece of the U.S. federal government. So without going into the specific details, the emergency use authorization was provided by the FDA after a lot of back and forth. I think the way it was explained to me, the masks that come out of here have the same level of decontamination as a mask that's purchased new from a manufacturer.
So how many times can they be reused? The manufacturer, Patel says up to 20 times. Last week, Secretary Sutter says it was between 5 and 10 times.
Yeah, I think it is approved to go to 20 times. Battelle did a lot of preliminary work. I think at least speaking for our hospital system, we're confident being at that level. But the plan, from a logistical standpoint, is probably less, and 5 to 10 may be a more precise number. But it's good to go to 20.
Can you explain what we're seeing and what's happening in each container?
Happy to. So this is the Battelle system, similar to one that was deployed at the other sites in the U.S., the 3 original sites in Ohio, state of New York, and state of Washington. You have 4 trailers that have exactly, if you can see the numbers, 1 through 4, and Greg has named them in honor of sports teams, given his local roots here. Each of these have exactly the same role, and so as they ramp up, these will be running concurrently and around the clock. The Battelle team is staffed to operate these 24/7. So essentially, masks come in, there's some sorting, they go on racks. The racks go into these units. The treatment takes place over a period of about 4 hours. Then the masks are repackaged for shipping back to the site of containment, of site of origin. I'm sorry.
The same masks go back to who dropped them off?
Yeah, absolutely. Absolutely.
They have their names on them.
So I have a question about funding. It's great that the mask decontamination part is free now. I understand that partners made an upfront financial commitment to bring the Battelle system here. Can you tell us how much money that was?
Thank you for that question. So 2 Sundays ago, we heard, we were on a conference call early in the morning. We heard that Battelle had this system. We reached out to Battelle. 2 days later, we had a deal. The deal was based on us committing to use the system. There was no exchange of money of any kind. And now that the federal government is covering the cost, we don't expect any exchange from us or any of the other hospitals.
And was there any state or city money that went into it?
The mayor can speak, or the governor, on that front. But the cost, there was cost in getting the site prep, having the contractors here, and a very close linkage with Federal Realty. Do you want to?
From the city, I can tell you, there's no money from the city other than staff time, and the administration, the governor, the administration can speak to COVID-related 19 expenses being reimbursed to cities and towns. So, and as I mentioned earlier, Federal Realty Investment Trust is currently not seeking any compensation for utilization of this building.
I mean, keep in mind the way the federal government's grant isn't going to last forever, but it's going to last for a while, and that's a good thing. But eventually, the way this works is you basically pay to have your gear decontaminated. The price you pay to have your gear decontaminated, in most cases, is going to be less than it would cost you to actually go buy new gear. So, for all intents and purposes, it's an expense that would be incurred by healthcare providers anyway. I do want to give Dr. Biddinger, who's sort of a leading authority on infectious disease, an opportunity to speak about the question that was asked about the validity of the process and the decontamination system itself, because I think that's important for people to hear.
Thank you, Governor. I would like to also add my thoughts and thanks to the Governor, to Lieutenant Governor, Mayor Curtatone, Battelle and Federal Realty. This really is an extraordinary opportunity to continue to protect our healthcare workforce. We have nurses, respiratory therapists, physicians, so many clinical staff who are caring for patients, and for so many weeks and now months you've heard me say that we cannot buy enough of the personal protective equipment that we would like. It's just not there for purchase. And so really, even beyond cost, it's just access to the N95s, and to have an opportunity to provide more N95s to our healthcare workforce is absolutely essential. The technology, as I understand, was actually originally tested and approved in terms of kill rates in 2015. So this isn't something that was just put together within the last year or two. It's been something studied previously and achieves what we call a 6-log kill rate, which is sufficient to call it absolutely safe from a bacterial and a viral perspective. And this has been tested. And so this thankfully is technology that is relatively more time tested over several years, and then we're very grateful for the FDA's emergency use authorization that permits it to be used. But again, in terms of expanding the available pool, not just within Partners Healthcare, but for all the hospitals of the Commonwealth that are reaching out to be part of this process, this really represents an opportunity to have more PPE for the frontline healthcare workers who need it in ways we just cannot purchase on the market, almost irrespective of price. Yeah. Yes, ma'am.
I have a question from a Somerville resident asking about what safety measures are put in place to make sure that none of the contaminants get into the neighborhood. What filters, airlocks, those kinds of things.
I would not be the right person to comment on the technical aspects of that. I mean, Chris, or we could, or do we want to have Greg? Greg, can I ask you to? No, I'm sorry, I can't. I'll connect you with someone to follow up, or Chris. I'm sorry.
There are people better equipped to answer that question here if you want to go into more detail after, but at least as I understand it, the system is sealed, obviously in its conduct of its work. There's the flow of the outside from the units. It's pressure going both ways. I don't know. We can talk to you afterwards if you want. Yeah.
Let me just add that, in addition, our staff, our team of inspectional services, public health inspectors, and Board of Health have inspected the site, played a role in maintenance stage in this area. It's been ascertained and again confirmed there are no dangers in terms of what's being emitted from here.
Milford had put in a sizable order.
Say again?
Milford had put in a sizable order for PPEs. The federal, they put in a sizable order. They say the federal government intercepted that order. FEMA was the organization that they had named. I reached out to FEMA today, and they said they're not taking order shipments that are planned for different communities. What are you hearing about situations like these, and anything you're going to do to help Milford or other communities deal with?
Was it the town of Milford or Milford Hospital?
Town of Milford, and they were for Milford Hospital.
Okay, well,
and first responders.
I'm not familiar with this one. I'll follow up on it. Obviously, there are many folks in the public sector who, over the course of the past several weeks, have had orders disappear. So we'll follow up with Milford and see what the story is there. But look, I talk to governors all the time, and well, I've had my own experience with respect to this, which I've spoken of. There are plenty of other governors who've had similar experiences, but we'll follow up with Milford.
What's your reaction to losing that supply? It's 30,000 gallons that you're supposed to be getting.
Like I said, I'll talk to him about it and see what we can do to help him. The answer is yes on both cases. The DCU has started accepting patients. I think they started accepting patients on Thursday, right? And the BCEC started accepting patients last night. Well, at this point, they're pretty small. The Newton Pavilions also started to accept patients. I think Newton has 22. I think the BCEC at this point has a handful. And I think the number at Worcester's less than 10, isn't it? Cape Cod is going to be open probably Monday. This is the beginning, folks. We've said this before. This is the beginning. The reason for creating this capacity, which has been an enormous amount of work by a lot of people, is to recognize and understand that we need a lot of empty staffed capacity to be available to deal with what we believe will be a very difficult next 2 or 3 weeks. And this is what we've been planning for the past several weeks.
Last question.
Governor, the president says that
about the importance of allowing grocery store clerks to allow them to react to the testing at places like so that might make that decision, sort of the pressures that they're feeling inside the stores?
Well, there's first of all, there's a growing consensus about this particular virus, that there is a minority population, but a significant portion of the population who are not going to show symptoms. They will be infected, they are carriers, but they're not going to show symptoms. Now, that's an almost impossible number to figure out until you get testing in some part of the world to a level way beyond where it is now. But the estimates range anywhere from 20 to 40%, depending upon who you talk to. Part of the reason we decided to put the advisory out on masks or face coverings, if you can't be in a situation or a circumstance where you can distance appropriately from other people, is because of this issue of people who may be in fact infected but have no idea. This goes both ways. The point behind the face covering is not just about protecting yourself from somebody else. It's also about protecting somebody else from you if you happen to be one of those people who doesn't know you've been infected because you aren't showing any symptoms. Now, it's going to take a while for everybody to ultimately figure out, because again, we're dealing with a new virus, an unprecedented circumstance here, what the actual size of the infected but not symptomatic population is. But there's no question at this point, based on what a lot of the experts are saying, they think it's a much bigger number than was originally anticipated. So part of the issue here about wanting people to wear face coverings or masks if they go to a supermarket or a pharmacy or some other place where they can't be sure about their ability to distance is to not just protect themselves from others, but to protect others from them. Same goes with respect to the guidance we put out earlier this week about limiting the number of people who could be in a supermarket at any given time, or a grocery store, to 40% of the stated total occupancy of the site. Once again, designed to create physical distance between people who are in there shopping and the people who are actually serving them. And the decision we made to make the sites, the testing sites, the drive-through sites at Gillette in Foxborough and at the Big E in West Springfield was specifically designed originally for first responders, emergency responders, but we expanded it based on some of the data and some of the discussions that we've had with folks in public health about the fact that grocery workers are exposed all day long to a lot of people who may not be symptomatic, but may in fact be carriers. And that's why that face covering is such a big and important issue here going forward.
Governor, what's the latest on the ventilator situation? The president continues to say that governors are not requesting much and have everything they need for the surge.
So I think people know that our original request, which we believe was approved at one point, was for 1,000 ventilators. Since that time, we've received 200 ventilators, and there are 200 more that are coming. We're pretty well confirmed. I mean, Secretary Sutters talks a lot about the fact that until it lands, it's not real. But I do believe the 200 additional ventilators are coming. The message we got from the feds was that we would be receiving ventilators on an incremental basis, I mean, so far they're living up to that. You know, they gave us 100, they gave us another 100, they've committed another 200. We're obviously going to continue to pursue the full 1,000 that we believe we need. We're also pursuing a variety of private sector channels that I believe remain promising as well. But as Dr. Biddinger said, the whole process around gear, however you want to define it, is one that we are working all the time, every day. We're still working channels on additional N95 masks. We think this is a terrific tool to help us create a much longer shelf life and useful life for N95 masks, but we're looking for more of those. We're also pursuing gowns and pappers and a lot of the other gear that people on the front lines are going to need. And we're going to continue to do that.
With it being Easter weekend, past week is happening, we're in the peak right now. Maybe just we've done it a number of times with stress. People want to be with their family. They want to go outside. The weather's finally nice. It seems like we never stress it enough how important it is to not go out. Are you seeing a better look at that, or are you still not happy with it?
So we've tried to be pretty clear in both our messaging, our guidance, our advisories, and our orders about how important it is for people to maintain social distancing and to use good hygiene and to take these issues seriously and to understand and appreciate the fact, especially with some of this new knowledge coming out that implies significant portions of the population can in fact be infected, can in fact be carriers and show no symptoms, how important it is for people to use the face coverings and to socially distance and to use good hygiene. I think in many ways, based on what we have seen just generally out there, people have been pretty good about that. But when we see things that concern us, we act on it. When we saw a lot of activity at the beach last weekend, which was a pretty nice weekend, we banned parking at the beaches. And we expected and we did see a number of waterfront communities follow our lead on that one. This weekend, we are shutting down a number of our parkways, something we did in conjunction with our colleagues in those communities to make more space available for people to walk and to walk with distance if they need to go out. But the overarching message all along, and it's been one that the mayor and his colleagues in municipal government have shared time and time again, and that the lieutenant governor and I have discussed over and over with our colleagues in government and our colleagues in the healthcare community, is there's a reason why we've taken these draconian measures with respect to essential businesses. There are reasons why we've taken these measures with respect to stay at home, and why we've been so aggressive about encouraging people to not go out unless you have to go out. I mean, we all get the fact that the economic impact of these decisions is profound, and that's playing out in the data. But when you're dealing with something that's as contagious as this particular virus and is as deadly for certain populations as this particular virus, you have got to understand and recognize the role you can play in protecting not just yourself, but the other people you come in contact with. And I said the first time we limited gatherings and basically shut down services in houses of worship, how brutal I knew that would be for many of my friends and the people I know for whom their faith is a core part of what they're about, and those opportunities to practice shoulder to shoulder with their friends and their neighbors and their communities matters to them. But we just can't be doing that stuff now, and we especially can't be doing that stuff as we head into this very difficult month of April, which is, based on all the modeling that's been done, probably going to be the toughest month for the people of Massachusetts. And one of the things I said yesterday, if in this Holy Week people need to pray, I would urge them to pray for a lot of the folks who are going to be taking care of those who get sick, praying for those who do get sick, and praying for their families. This is going to be a rough time, and I get the fact that it's a nice day, but people really need to accept the fact that that this virus is insidious, in some cases is invisible, and and it will prey on people if you give it the opportunity. The best way you can kill it is to not give it to somebody else and not get it yourself. And that means staying away from people for the most part, except those you may share a house with or an apartment, and really limiting your outdoor activities to those essential activities we've discussed before. And if you can wear a face covering or a mask when you can't socially distance, please do, because it will help not just you, but it will also help other people as well.
Thanks, everybody.